Hi, I'm Andrew Suchocki. I'm a physician. I'm a family medicine doc by training. I'm the medical director with the Clackamas County Health Centers. I love working in Clackamas County because the people are tremendous. I love the sense of community. I love the dedication of the people who work for us, and also caring for the patients I have. It's just, it brings joy to me every day. Caleb A. writes to us, "Hey Clackamas County, go f*** yourself. The people are done with your tyrannical sh**. Quit peddling your, in quotes, vaccination crap." I have patients who are in their 20s and 30s who, after being infected with COVID, have become suicidal. They've not been able to run. They've barely been able to get out of bed for months. The risk of having long-haul COVID symptoms, no matter what your age, is way more than the risk of an adverse reaction to the vaccine. We're talking 1 in 3 versus 1 in 500,000. I know which one I'd choose, and I have a feeling, Caleb, you would too. So please, do it for the most vulnerable in the community and get vaccinated. Phyllis S. writes, "Unvaxxed are not spreading anything. Those that got the jab are. Doctors are trying to speak up. Unfortunately, they are being silenced." Well, Phyllis, I'm a doctor and I'm speaking up right now. I don't agree with you. The facts are pretty simple. If you're not vaccinated, you're at incredibly high risk of getting COVID. If you look and dig into who those physicians are, you're gonna find that they have ulterior motives, and a lot of them are financial. Or they have views that, the more you dig into it, such as, belief in alien DNA and a bunch of other things. I mean, some of these physicians are truly out there, and it's actually amazing they still have a medical license. And I wouldn't be surprised if they lose it. The next tweet comes from Trisha J. And she says, "My real doctor at the very real Kaiser Hospital gave me Ivermectin, the exact same drug your beloved legacy media keeps saying is dangerous." So we look at effectiveness of vaccine, of Regeneron, and antibiotics to support other infections. We know those work. Ivermectin, we just don't know. And again, not right now, the risks are not worth the potential slight benefit. And I say slight because it's very disputed in the literature. What you're seeing is something that we would debate as physicians and scientists for decades, but we need to do it in months. And it can be really frustrating to see science work in real time. It's sort of like sausage making. All right, William B. writes, "Stop allowing COVID-positive immigrants into this country. Stop pretending to care for our health and safety. 18% of the hundreds of thousands have COVID-19, then are bussed into cities throughout our country. Is that okay with y'all?" Well, William, I hate to tell you, but the country that's the pariah in the world right now is here. We're the problem. Can immigrants have it? Sure. They're human, right? The likelihood of them having COVID it's possible, right? But we are the global leaders in spreading this illness because we refuse to get vaccinated, because people don't wear masks, people don't respect social distancing in the appropriate setting. We are the problem. Pamela G. writes, "I wouldn't take the jab even if it was FDA approved. Big Pharma doesn't care about you. All they want are new patients." Well, Pamela, I see where you're going with this, and let's unpack that just a little bit. So FDA approval has been achieved. So there's that. The second thing is FDA approval takes a long time. And when you're in a global pandemic where time is of the essence, you just have to make those decisions to grant an EUA, for example. We know it's safe. Then none of this is new. The science behind the mRNA vaccine is old science. The science behind the Johnson & Johnson vaccine is established science. Christopher H. writes, "Why get the shot if you can still get the virus afterwards? Don't make any sense to me. If you come up with a shot, too, where you can't get the virus, then I'll get it. Anything else is a waste of time and money to me." So, Christopher, you lost me a little bit, but I'll answer what I think you were trying to ask. COVID can give people, in some cases, permanent disability. So that vaccine, it lessens the blow of the illness, number one. And number two, the likelihood of you getting it is still less which means you're less likely to infect your elderly parents or grandparents or vulnerable children that can't receive the vaccine. So I hope that helps.